Okay, so my broken tooth was removed, and Neil had talked me through what my options were for the implant. Basically, I then came in and I was a little surprised that the normal room that we were always in was set up a little bit differently. But Neil was really great. He assured me that it was set up differently because it was more of a surgical procedure and something to do with the hygiene. They had to be up to scratch with all of that. So that was fine. I still felt comfortable. I got in the chair as normal, and I believe before we got to that point, Neil had sent me for some x-rays and a CT scan, so he had all the information that he needed. There's some technical things in there, but he sort of dumbed it down for me and told me exactly what was going to happen. So then it kind of led it to the actual implant being put in, pretty much. So I didn't really know what to expect when I was having the implant done. Even though Neil had explained it all to me and it was written down on a piece of paper, I was still pretty scared. So I just basically trusted Neil, and as far as I was aware, he was going to implant a post into my mouth, into my gum, and then it was going to be sealed with some sort of a cap, which it was in the end. That was probably the bit I was most worried about, as was I going to have this little post sticking out of my gum, or how was it going to be left, could I eat? And actually it was absolutely fine. It was all inserted as normal, I'm pretty sure, and he covered it over with the cap, and it was to the side of my mouth, so you could never see it. It wasn't visible, so I wasn't conscious of that. I could eat on it absolutely fine, and it pretty much just had to heal for the next couple of months, and then the tooth would actually be fitted to the post itself, to the implant. So I had the implant fitted, and the day after I actually went to work. I worked from home in the morning just in case I was in pain, but actually I didn't have any pain. I felt a little bit of swelling, but Neil told me before I had the implant fitted that that could happen. Neil advised me to take some ibuprofen as an anti-inflammatory, which I did, and that was absolutely fine. I didn't experience any pain. I could still eat as normal, and I actually worked the next day as well. So as far as I was concerned, I was on my way to having a new tooth that would last me for a long time, and I didn't have to go through any pain to get it, which was great.